welcome to the Women's Show. I am Chiatunga Rebecca Juna, and with me today, I host the clinician from Reproductive Health Uganda, Miss Shamila Ramiti. Welcome to the show.
Thank you.
And it's good to have a woman in the medical field in this space to talk to us about issues of reproductive health, sexual reproductive health. And Shamila, I'll start off with what would a woman consider before they come to your spaces and to access information around family planning?
Thank you once again. Um, when we are looking at women and family planning, I think we should also let women know that family planning, first of all, is their right.
Yeah.
It's their right. They have the right. They do not have to really look at the man or before they think about family planning. If they have to do family planning, then it has to be them. They have to make the final decision. And what is even family planning, for starters? Family planning is just a consideration a woman makes on how many children to have, when to have them. And also sometimes a woman can decide not to have children. It's also okay. It's her right. It's her body. So there are so many things that women have to put in mind if they're thinking about family planning, because we have to look at the social life of this woman, the financial status of this woman, and their career. Why at the beginning are you having family planning? We have different categories of women. We have those ones who do not even have children, but they want family planning.
They're sexually active.
They're sexually active, they're not married maybe, or they're even married, but the financial status at the moment does not, maybe may not be able to allow them to have children because they may not be able to support these children. Also, maybe career-wise, maybe that someone is taking on a new career and they want to first stabilize, and maybe later on they can have children. So before coming to any family planning clinic, a woman has thought about all those. If maybe this woman does not have children, she has thought through. Maybe if this woman has children, she needs to plan on when to have the next one.
Yeah.
Or the woman does not want to have, or the woman wants to stop. So when they when they come at the clinic, we teach them. We teach them. We give them information about the different types of family planning. What is family planning going to do to their bodies? Because I mean, this is something you're taking in, and everything you're just taking in has a side effect on the body. So you have to be considerate. So they have to know what exactly they are going in for and what is going to happen to their bodies.
Yeah. So I'm looking at the different family planning methods that are available. And one of the ones that is really very accessible is the condoms. How do we ensure that more and more women are acceptable of the female condom? Because you see, one of the challenges you have is that the man today wants to wear the condom, tomorrow he's tired. So could a woman take on the responsibility and say, you know what, I don't want to have a child, and maybe the other methods at the moment are not accessible. How do I, take on the female condom?
The female condom is good, but it's quite challenging. First of all, a few places have the female condom, though they can come to the reproductive health clinics and access them, but a few places have the female condom. And if you're to use the female condom, if you look at the procedure of using a female condom, I think the partner also has to be so much involved, because when you look at the technique of using a female condom, somehow the woman has to be holding the top part so that the man does not sleep on the side.
Wow.
Yeah, the woman has to be conscious the whole time they're having the sexual activity. So like it needs some conscious, so like the other partner has to be really also involved. But if a man has refused, let's say, to use the male condom, then and as a woman you really want to use a condom, then you have to take all the precautions. You have to see, but the most important thing is that you have to have a health worker guide you on how to use a
Yeah.
female condom, because if you use it incorrectly, chances are you're going to conceive or even get STIs.
Yeah. If we are to look at the other family planning methods that get into our bodies, what are some of the things? Take us through the procedures that you go through, the blood tests and all that, because there are so many myths about family planning. And women don't want to get fat, honestly. They want to take their family planning and still look good and still be able, to do other chores and, not bleed. There are those family planning methods that they've told us that you can bleed for 6 months when you get off it. So take us through that procedure for a woman out there to get ready.
Yeah, thank you. Now, when after a woman considering, and then they come to the clinic, the first thing we do is we take them through. We have to give them information. We have to do the counseling. We have to give them information about the different types of family planning that are available, because we also have to know. And then after telling them the different types of family planning, commonly the different types of family planning in Uganda are the pills, the injection, the implants, and the IUDs. Then there are also the permanent methods of family planning. But a few people take on the permanent methods of family planning. Usually they come when they either want to limit or they want to delay conception. Yeah, so we do the short terms or the long acting ones. These days, the good thing is that women are really taking on the long acting ones, because the long acting ones make sense, and chances of a woman forgetting to take a pill or forgetting the date to come back for an injection are limited. And the long acting ones usually are the implants and the IUD. So when we tell them, we give them information. This information includes on how does the method work, where do we put this method, because every method has a site on the body where we insert it. Now, like, let's take an example of an implant, which is started under the arm, under the skin of the arm, and then it doesn't pain. You don't really have to squeeze the eyes. It doesn't pain. And then the IUD is inserted in the uterus. But it's inserted, of course, with a skilled person does the
Is the
procedure.
IUD still the same as the coil?
Yes, thank you. The IUD is an intrauterine device. There are two types of the IUDs. We have the hormonal IUDs, and then we have the non-hormonal IUDs. But I'm just, taking it through. So we, after telling them the different types of family planning, how they work, where do we insert them, how we do it, so that, she feels more comfortable. And then we tell them the side effects. So a woman will leave the clinic. If they have taken a method, they will know how it works. What are the expected side effects? So that, because if you don't tell a woman what they're going to expect, even a fever can be a side effect of family planning. To a woman, they will get a fever and then they tell you, family planning has brought me this fever. In the local society, a woman will tell you, and it could be a malaria or typhoid or something else. So you have to really, if you're a service provider, you have to tell these women what they need to expect. A woman can even stay home with a fever saying it's family planning. And if they really need to go to the health center and see what is causing this, they get a discharge and they say it's family planning. Discharge. They're having a UTI or an STI, and putting it on family planning. So it is very good if a health worker or a service provider gives this information and tells this woman, this is what you're going to expect. And if it comes, how do you go about it? Because that's important. If a woman is bleeding and you've told her it's a side effect, yes, it's a side effect. How long and how heavy is this woman going to bleed to know that now this is dangerous? I need to see a health worker. I need to do something about it.
Let's tackle the issue of why does some family planning method that you all not work. For example, the emergency pill.
Yeah.
You have made women conceive when they were not supposed to conceive, by giving them those pills. Some have taken maybe a method that then the next time they're like, but I'm pregnant. How has it happened? What are those causes that let us have family planning methods that are not working? Because a woman wants to go on with her day, free from having a child, and the next thing there's like a burn in the oven.
I know. Now, family planning. I usually tell women family planning is okay. All types are good.
Yeah.
It just depends on the user. Wrong use brings a lot of issues.
What is wrong use?
Now, I take it a little bit back. Like
Yeah.
I said, when a woman comes, we tell them everything they need to know. We tell them how the method should be used.
Yeah.
Now, we've told the woman how a method should be used. Let's give an example of an emergency pill.
Yeah.
Now, we tell a woman an emergency pill is an emergency. It's an emergency. You use it in cases of emergency. But women go ahead and abuse it. You find a woman taking it every week, every day. That's abusing now the method. It's an emergency pill. It's not a method.
So in a year, how long is a woman supposed to use an emergency pill, or in a quarter?
A quarter once.
Once.
Yeah, if someone has to use an emergency pill, it has to be once in a quarter of every year. What? Yeah, so if a woman is using it more than, then they should come to the clinic, or they should go to the nearby health center and get a method, because now it ceases to be an emergency.
The body gets used to
the body will tolerate it. And what happens next? This woman is going to conceive, and what happens next? They start buying pregnancy test kits. They first buy the emergency pills. They buy them.
Yeah.
Almost every 3 days they're buying them. And at some point they start buying the pregnancy test kits. And then they get
to
pregnant.
Pampers.
And then some might even not get there. Then they start looking for abortion pills. Some.
Yeah.
Because an unplanned pregnancies, it's a big deal.
Yeah.
So some may go to Pampers, some may not. And you know the risks in between there.
Yeah. We need to talk about, you talked about the issue of abortion, and we need to talk about how abortion is not accessible. I think it's a conversation that we tend to cover up, but the reality is that they are happening.
Yeah, it is.
How do we ensure that a young girl or a teenage girl or a university girl that has had an abortion has the right kind of abortion? Because people putting hangers there, it doesn't work, and we might lose lives. For a girl that is out there, or for a woman that is out there that has had an abortion, but it might not have gone well, what should they do immediately if they start feeling strange? Their body is, strange.
Yeah. Now, for a person who has had an abortion, and they need to go to the clinic, because most clinics, at least, offer post-abortion care. So they need to go to the clinic, know what is happening. If you had an abortion or if you had a miscarriage, you need to go to a clinic. Maybe you need to take an ultrasound. You need to be examined by a doctor or a clinician or a midwife to see was the process complete. Because if the process was not complete, complications may arise.
Complications like what? Death, I know, but what other complications?
Complications can arise. You can get what we call sepsis. Sepsis is something like okuvunda.
Oh,
yeah. Let me say. So like you find someone having pus coming from the uterus, maybe because the process was incomplete, or the things they used were unsterile, and they got microorganisms in there, and then there's pus coming in, and then it leads to complications, like sometimes removing the whole uterus, and then this person may not even be able to have children again. And maybe this person has never even had children and was like, let me remove this one since it's unplanned, and then I see a way of planning, and now they cannot have children anymore.
Wow.
or they might get fistulas, or different things happen. So people really need to be careful when procuring an abortion, for starters. And then afterwards, they need to really go. First of all, the disadvantage that we have is that there are strict rules about abortion in Uganda. And so people should take precaution. That is why we are emphasizing so much on family planning. Because, you know, in health, we have primary prevention. And primary prevention is family planning.
Yeah. Is there a family planning method for the men? Because they have a role to play in this whole thing.
They do.
Apart from condoms, which other family planning method is there for the men? We need to ensure that the men have their own family planning so that women do not carry the burden of, you know, family planning and being the only ones that check their calendar. When am I ovulating and all that?
Yeah.
What family planning methods are there for men?
Now, before we even look at the family planning, they have a big role also. Men should know that this child is not for only the woman.
Yeah.
So before thinking about sleeping with this woman, because you know the repercussions of sex.
Yeah.
A woman may conceive, or they may get different STIs or different things.
Yeah.
So a man has to know that he also has a role. So before, he should at least ask a woman, are you using any family planning method? You shouldn't be shy. You shouldn't be shy. They should ask. They should ask and get to know. If this woman is not using a family planning method, that means she might conceive in this process. And if she has to conceive in this process, am I ready to have this child as a man now? If this man is not ready, then he should at least use a condom, because the disadvantage is that there are only two types of family planning for the men. We have the condoms and then the permanent method, which is vasectomy.
Men, you should go and get vasectomies.
So those are the two methods we have for the men. So if a man is satisfied with the number of children they have, and they think they need to stop, they can do a vasectomy.
Are there instances where the vasectomy fails? Because you hear somebody say, me, I got a vasectomy. Where did you get the child from? Are there instances where the vasectomy fails?
No. A vasectomy, if it is done by a skilled person, it never fails, because there are also precautions we take when we are doing a vasectomy. First of all, we have to counsel the man. This man has to be ready, because we don't want this man to regret also.
Cutting his tubes.
Yes, I did the vasectomy and now I want to have children and I cannot have children. Or maybe the wife dies and has a mogole, and this mogole has to also have children. So we do the counseling. We let them know what is going to happen. This is a permanent method and blah, blah.
It's irreversible.
It's irreversible. And after the procedure has been done, we tell them, we give them 3 months. These 3 months, we are looking out for the sperms that have already crossed, because when we are doing the vasectomy, we are cutting the vas deferens. There's a tube that connects the where the sperms are manufactured from to where the sperms the sperm duct, where the sperms get out from. So that is what we cut, so that there is no connection. The sperms can be produced, but they will be reabsorbed into the body, and they cannot cross to the other side. But the man ejaculates normally because the semen still coming. So they function normally, biologically. There is nothing that is destroyed, but they cannot make a woman conceive. So when we have done that process, and then we give them those 3 months to make sure that even the sperms that have crossed die off, or they ejaculate them, because we also tell them to be sexually active so that they can ejaculate them off. But in this meantime, let's say for a married man, we tell the woman to use another family planning method. So when the 3 months elapse, they can do away with the family planning.
So one can conceive within those 3 months?
There is a likelihood of conceiving, yes, if they have not done as the doctor has said. So they have to follow the instructions. Now, if the 3 months have elapsed, we tell them to come back still at the clinic And then we do what we call a sperm count. Like, we do a semen analysis to make sure there is zero sperm. And when there is zero sperm, this man cannot make a woman conceive. So
Wow.
if a woman conceives,
She has gone outside. She has
exactly,
played an away
because
match.
I mean, we have done the semen analysis and there is zero count. Where is this woman
Getting the child from.
exactly? So,
Well,
but that also causes chaos if the man has not told the woman,
man,
because
yeah.
there are some women who, move out.
But why wouldn't you tell me that you've gotten a vasectomy so that I understand my needs? But anyway, that's a talk for another day.
Yeah.
Yeah. But in terms for permanent family planning methods for women,
Mm.
when you cut the tubes,
Mhm.
is there a way she can reverse that decision?
No.
Still, it's also reversible for the woman.
Yeah, it's irreversible. That's why when we are doing a permanent family planning method, we actually intensify the counseling, because we have to make sure this woman understands the after effects. I can no longer have children. Even when these ones that I have die, I'll still no longer have children. I have no hopes of reversing.
Wow.
People who have tried to reverse these things, they have failed. Yeah.
So, for a woman out there, you've heard about the permanent methods, and not to scare you, but it's a long term decision that you have to take. And therefore, you have to think carefully about it. Don't rush into it. Get all the information that you need to have so that you can make that decision based on your needs. And as the local woman calls himself, kindly give us what are those things a lady that has miscarried, most of the times we don't talk about it, has to do after miscarriage. Because most of the women sit back home and they are crying and all that, but what are those things they have to do? How do they come back to the clinic for an assessment? Do they check into, because we know that psychologically it affects you? What are the key things a woman that has miscarried has to do?
The key things a woman has to do when they have miscarried, because there's physical and psychological effects. So first of all, we don't want to rush this woman into getting another pregnancy.
Yeah.
And we have to know the cause of this miscarriage. So it would be very good if you come and share with your health worker, with your doctor, with your gynecologist, and you let them know the incidences that happened before this miscarriage. How did it occur? How did this abortion occur? How did it occur? Then the clinician or the doctor may do some examinations and may tell you maybe it occurred because of this and this, because it is very good if we establish the cause of this miscarriage or this abortion, so that we prevent it reoccurring.
Yeah.
Because maybe if it was induced, that's okay, the woman didn't want it. But if it was spontaneous, if it just happened, what are the chances that it might happen again? So we have to do these examinations, we have to do these investigations, we have to take this woman, at least if we have to do an ultrasound, make sure she's fine. And then so many times we might need to give a family planning method, because we don't want to rush the next pregnancy. Because once a woman has a miscarriage, in 2 weeks, the fertility has returned.
Oh.
Yeah, so they can conceive again. So,
but doesn't their body have to heal?
Exactly. That is why we have to talk to them. We have to give them a family planning method to delay the next pregnancy. Let their body heal, let their body settle, let them heal even psychologically.
Yeah.
Because they've gone through a frustration, and sometimes it's even going to frustrate the hormones, and again, it might happen again. So those are the things we can do. But most importantly, we need to establish the cause.
Yeah. So for a woman that has miscarried, please go and check into a clinic or your health center so that you can access these services and try again. I do believe in trying again. But then we need to talk about those that are trying to have children. There's so many women there. that are out there that would want to have a child, but they fail to have a child. And they will tell you, my whole body is okay. The doctors have checked. What sex styles do they have to have so that they have their children?
Also women sometimes lie.
Mm-hmm.
Because a woman will tell you the doctor has checked, but they've not done all the tests. Because there's so many things that revolve around fertility. A woman will tell you that, but the doctor has checked and I am fine. But the woman has not taken the husband for a checkup.
Oh,
This is a two-way thing.
yeah.
So a woman has to go. If a woman is trying to conceive, this is a couple. Now let's say a couple is trying to conceive. They need to go, both of them, see a doctor, tell them their problem. Maybe they have tried. For how long? Also, that's important.
Wow.
A person will tell you, I've been trying to conceive and I'm not conceiving. For how long? 2 months.
Yeah. There is pressure there.
Yeah. But 2 months, that's a very little time, eh?
A little time to conceive, eh?
Yeah, because we diagnose infertility. Let me say, there are 2 types of infertility. We have primary, where someone has never had any children. And then we have secondary infertility, where someone has had a child or has been pregnant and has failed to have a child again. So if a woman comes, if a couple now, because we have to talk about a couple, with infertility, it has to be really a couple. If you're going in alone, it's not helping, because you may be fine and the other person is not fine.
The other party is not well.
And even if, okay, it's on you, but psychologically you have to be supported.
Yeah.
Because you're in this together. So when they come, of course, we do checks on both sides. Maybe this woman, maybe you might find that a man has a child outside. So this man will say, me, I'm okay because I have a child.
Yeah.
Now it's the woman. But you don't know that there is what we call secondary infertility. Yeah. You have a child, but...
What's that?
Yeah. What if we do all the tests on the woman and she's really fine? Yeah. And you have a child, yes. But we might do the test and you're the one who has the problem. So they need both come together. We do the different examinations. We do the different investigations. There has to be a cause of infertility, or there has to be a cause. So when we identify the cause, then we are able to tell them a way forward. Sometimes the cause is treatable. We can treat and then they can be able to have a child. Yeah. Maybe the cause may not be easy to treat, or we cannot treat this cause, and then we look at different options. There are different options like the IVF. So we look at different things that we can do for this couple to have a child. But also this thing, sometimes I tell things, there's also now when you have to just keep praying and believing in God, because there also are times when you do all this
and it fails.
Then you just have to keep trusting God. Because I've also seen a woman who did everything step by step as directed by the doctors, even did the IVFs, and they failed. And after 1 year, she conceived naturally.
Wow.
Without any pressure. So
it also has a spiritual aspect in it.
Exactly.
So, those that want twins, they have to go to God and pray. Because you hear stories that if you want twins,
I'm not saying they should not try medically. Of course, medically is very important. You have to know, you have to establish the cause, and the stress kind of reduces. Yeah. Because when you know the problem, it cuts off the pressure. Yeah. Yeah. And then you know what you're dealing with. So they should medically find out
what is wrong, what's challenging them.
Exactly. Yeah. And by the way, when you're dealing with infertility, you first have to cut off the social pressure, the relatives, the family. I don't know how women deal with it, because it's hard. Infertility is really hard. It's really painful for women, mostly, even men. Because anyway, if a man also is not able to make a woman conceive, you find him very stressed and frustrated. Yeah. But it's a hard thing. But what we need to know is that if they find out, how much pressure can they take in?
The
because
pressure is sometimes overwhelming.
overwhelming,
Yeah.
and you cannot do anything about it. It's God's decision.
Does sometimes pressure affect your ability to conceive?
Yes, it does, because you may put stress on your hormones, and then it is challenging. Of course, now when there's a lot of stress, your menstrual cycle is affected, and with fertility, most especially in men, we rely on the menstrual. In women, sorry, we rely on the menstrual cycle, because when we are looking at the menstrual cycle, we are looking at ovulation, and ovulation is the biggest player in this game.
How does a woman know that she's ovulating?
Yeah. Now, some women tell, because some women have really followed their cycle, and they can tell the signs. The body becomes a little warm, the vaginal discharge is very much, the quantity increases, and it being slippery and very clear. So a woman can tell, I'm ovulating, by the look of the vaginal discharge, maybe the basal body temperature, like the temperature, and also the sexual libido. God made us in such a way that when a woman is ovulating, because when ovulation happens, the body is preparing to conceive. So God made us in such a way that even the sexual libido increases. You feel you're very ready. You want to engage. The vagina is very moist, because the discharge is there and it's very slippery. You're in that
Just
mood.
ready.
Very ready. So it can happen. But also some women cannot tell. Some women do not tell this.
So in most cases, when a woman is sexually, ready and has a high libido, it is the most likely she's in her ovulation window.
Most likely. Chances, 90% of the chances are she's in her ovulation. But now women have modernized. They have those apps on their phones, so they follow the apps.
Menstrual app, yeah.
The menstrual app is very important, because it also helps you to learn more about your body. So like when you reach in that time where it's showing ovulation, you can also listen to your body, check your body, and see. If you do not know how to listen to your body, you get to know, what happens to my body in this time.
Yeah.
You might do it for the first month, and maybe you don't get it really. You do it for the second time, you do it for the third time, you will see.
Can a little bit of, let's say, change in diet, change in food affect your ovulation, or does it just affect your menstrual period?
Change in diet.
Change in
not
diet,
really, but
traumatic experiences.
Traumatic experiences can affect your menstrual cycle, because when traumatic experiences happen, most people are very stressed, and when they are stressed, their hormonal levels also tend to go down, and sometimes there's no ovulation. They're not even seeing their periods. By the way, when you don't see your periods, just know even ovulation has not
happened. Oh.
Yes, because ovulation has to happen first, then you see your periods. That comes also to mothers who be there waiting for their periods. Mothers who have given birth, who wait for their periods to come, so that they can resume family planning. They've had their children, they've had their babies, and then they're waiting for their periods to come, their menstrual periods to come, so that they can resume family planning. Then they end up conceiving.
Yeah.
Because ovulation happens first. So as you're waiting for your periods, ovulation has happened. You engage sexually, you conceive, so you don't see your periods. You just continue.
Yet something has already been put inside.
Yeah, so by the time they just start feeling funny, and then they come and they're like, I even didn't see my periods. Yes.
Because you ovulated and you caught a goal.
Yes.
I think ovulation is a funny thing, because it happens to you and it's not visible.
Exactly.
And then you are not on any family planning, and before you know it, you are saying, Jesus, this is not something I expected. So women out there, please watch your bodies. Go download those menstrual apps, so that you can be able to understand what your body is about to give you, and so that you also know what time and when you should engage in sex. But Musao, we need to talk about the fact that somebody can be breastfeeding. I have so many friends that have been breastfeeding, and the next thing you find hunger, she's capital D. And you're like, but what happened? She's like, but I was using breastfeeding as a family planning method. How realistic is it?
Now, breastfeeding. Now there's some family planning methods. Let's say all family planning methods are not 100%. But there are those at least that are beyond 99%. And then there are those that their percentage is not really good. And breastfeeding, we call it lactation amenorrhea, falls within. And there are also things we should consider when we are using breastfeeding. First of all, a woman has to be breastfeeding exclusively.
Wow.
Exclusively. The child has to be below 6 months. So, and the periods have not returned. So, if you're not among those, please have a method. But there are those who are even very fertile. Even if they are exclusively breastfeeding and maybe the child is below 6 months, you don't know when the fertility is going to really return. I was discussing with some doctor and he was telling me nowadays we are considering for as long as the woman leaves the hospital after they've had that postpartum bleeding, immediately the postpartum bleeding ceases, we know that woman's fertility has returned.
Wow.
In most cases, that woman's fertility has returned. So postpartum bleeding ceases like in 4 weeks, if it really goes on. 4 weeks, at least most women. So in 4 weeks, after 4 weeks, a woman's fertility easily comes back into it. So like at 6 weeks, some women are really fertile and they're ready to have that. Their bodies are ready to have
Receive another baby.
So you find a baby is making 2 months and this woman is pregnant already.
Hey.
Yes.
They grow up like they are twins.
So it's a bit hard.
Yeah.
So what we encourage women, lactation amenorrhea used to be very good. But nowadays it's no longer effective. So the woman has to get a modern family planning method. And they have to be sure, because I have this thing. If a woman is not ready to have a child, they're not ready.
Yeah, you're not
Psychologically, ready. Physically, financially, sometimes they're not really ready.
Yeah. Even with the energy levels of you have this one and the other one is coming.
I know.
So you neglect both children because you can't balance easily.
Yeah, so they have to really seek for this family planning method. You have to go to the healthy center. You don't have to listen to the society, because the society has a lot of information, which is sometimes valid or sometimes invalid.
Yeah. What causes a woman to bleed and or get her menstruation even after she has given birth? Because we believed that, after 6 months, I have seen mothers and I thought after 6 months, that's when you can start to menstruate again. Do you find somebody has given birth and before you know it, she's menstruating again?
It's about the fertility levels. We are different. Every woman is created different.
So if you menstruate again, it means that you are fertile.
If yes, because like I told you, ovulation happens before menstruation. So the moment you menstruate again, you're just fertile. You're ready to have another baby.
Wow. So women out there, if you menstruate immediately after, you've left that hospital bed. But I think there are times it's just bleeding because of, effects of childbirth. But if you menstruate, I think after 2 months or something.
There is what we call postpartum bleeding. Postpartum bleeding, that happens after childbirth. But it takes different days for different women. Some women bleed for maybe a week, some 2, some 3, some 4 weeks, some 5, some 6. Those ones who can maybe bleed for long. And it shouldn't exceed 6 weeks.
Does it also put into consideration if you've given birth naturally or if you've had cesarean? Do also people with cesarean have to wait 6 weeks, or for them is it like one week?
It depends. It depends even on the doctor who has done this. There are some doctors who will do and make sure most of the products of conception are out.
Yeah.
And there are some doctors who will do and maybe leave. So it just depends on how the procedure was done, who did the procedure. And maybe some women just have that bleeding thing. So it depends on so many factors. And it is independent of whether it's cesarean or naturally. But most cesarean mothers bleed for a short time because most doctors make sure they take out most of the products. So most cesarean mothers have a short time of postpartum bleeding. But mothers should at least, if they know they're going to resume sexual intercourse early, they should seek for family planning methods, because most especially now for the cesarean mothers, it's even dangerous. At least a cesarean mother should have a next pregnancy after 2 years.
After 2 years for a cesarean mother. Then for normal childbirth, you can do after 6 months or 1 year.
Also, if they can, let them do 2 years.
2 years to give
because
your body.
2 years this baby has at least independent.
A little bit.
A little bit.
They've gone off the breast. They are starting to talk a little bit. They move.
And you also now feel a bit independent. You know, all the time. You know, I am a mother as well, so I know the experience.
I'm not yet a mother, so I am an auntie.
The rich auntie gang.
I'm the rich auntie to my nieces.
Yeah, so I'm a mother out of experience. You know, whatever you go through after childbirth, it's not a joke. It's not a joke. So at least you give yourself time to rest and heal. 2 years is okay, even if you want, because some mothers will say, then I rest or go back and do my career. That is okay. But at least give it, if it is really now for these ones who have had normal vaginal delivery, if you really want to do it so much on time, you can do 1 year and a half.
1 year and a half, 2 years spacing.
Because I believe at that time someone has at least healed naturally.
Has healed and also given time for the baby. We have seen cases for women where women get depressed after childbirth. How do you help those women?
Now, this is now my own opinion. I think most women kind of get depressed, but the level just differs. There are those ones who get just minor depression. You know, you've given birth to this human now. There's so many changes. This baby is crying in the night.
Yeah.
Because newborns, it's not a joke. A newborn is not a joke. They are crying. Their sleeping schedule is different. It's weird. And you know, you have to help them. Now it's even worse when it's your first time. You don't know what to do. You don't know what to do. You're trying to learn, and you have to help this human. The breast milk is a lot. This baby is not breastfeeding a lot. You're having issues with the breast milk. You're having different issues. So all women need support. Of course, there are those ones whose depression is too much and it's worse, and they even need to see doctors. Sometimes they get onto medication. Sometimes they just do therapies. But the people around have to really understand these women.
Very good support system.
Exactly. And also, it is very challenging for women, maybe after giving birth, and they just go back home and there is no one. You know, the husband has gone to work. You're just alone at home. You have this newborn. You have to do housework. Now, that is where it is really frustrating. At least if someone gives birth, I think they should have some support system. Even if it's for a month, at least. Because this new human being here
is your center of attention.
Exactly. And it's a lot of work. For the first 3 months, it's a lot of work.
Well, families out there, we encourage you to support the new mothers. And if you're a new mother, please seek support from the family so that we do not lose you to unpaid domestic care work, because we need the child but also need the mother. As we try to conclude, there is an aspect that most women would want to know. Is it okay to have sex during one's periods? And
Now,
give us not a fancy view of we are in trial and error, but give us that medical view of the impact and what a woman will go through.
Okay, I'll start with a medical view. I'm a Muslim, and
Yeah.
Islamically it's so wrong.
Yeah.
So, but let me start with the medical view.
Muslim women don't have sex when you're in your periods.
Medically, the vagina is going through a lot.
Yeah.
There is this blood that is shedding from the uterus, and when you're in your periods, a lot of things that are happening.
You're having PMS.
You're having either a tampon or a pad that is there, and the way you close off somehow your body, the temperature in the vagina kinda is warm, and remember there is blood, so there's this environment that is good for the growth of bacteria or the fungi. So again, the cervix is also slightly open. So chances of you getting infections are very high at this time. So if someone must, this is now my opinion, if someone must avoid sex during, it's not biased.
Yeah.
If someone has to avoid sex during menstrual periods, they have to. But there's sometimes when medically, we tell a woman, now like there's some women who ovulate during their periods now, and they're trying to have a child. Sometimes we medically tell them, you can have sex during the periods, but if someone can avoid, please avoid, because chances of you getting infections are very high at that time. And I don't know if they enjoy those ones that, because the uncomfort during periods is too much. It's too much. Sometimes you're cramping.
You're having premenstrual syndrome.
This
You're
mood
moody.
changes.
You want to eat maybe chips.
And what I know about sex is at least both parties have to enjoy.
Yeah.
Because if a man is really forcing you to have sex even during periods,
that is not a good
this
man.
relationship is not healthy.
Man. Yes, it's a toxic one.
Yeah. If you're married, at least you should have conversations, a lot of conversations, because I hear there's a married man who don't want to know whether a woman is having their menstrual periods. Whenever they want to have sex, they want to have sex, and this woman has to be ready. But I think when you do a series of talks, this person can change. Marriage.
This person can change.
Marriage is also hard, and it is funny. But that is why we say marry your friend. Because if it's your friend and you have a series of conversations,
because for somebody that menstruates, let's say for 5 days, you're having 3 days the heavy menstruation, then the other time you're cleaning up, and this one's excuse is I can't wait for a whole week.
Exactly.
Why can't a man wait for a whole week?
The blood has spilled, the hygiene.
And then you also have to be the one to clean.
Exactly.
It's a very selfish man that asks for sex during menstruation. That is a very selfish man. And it's not a holy act.
It's not. It's not. Islamically, it's wrong. It's wrong.
So women out there, the disadvantages of having sex during menstruation, and therefore it should be cautious unless you're trying it for a baby, as Musao has said. But for women that have done it and gotten infections, they wanted us to talk about it very well. Infections like herpes, warts, gonorrhea, syphilis, candida, which other one? There's so many sexual transmitted diseases. Just in Mubufunzi, in a short, what advice would you give a woman that feels that her body is infected?
First of all, vaginal hygiene is very, very, very key.
Mm.
If a woman has to prioritize anything, it has to be her vagina.
Mm.
I mean, that's what I really tell women.
Yeah.
You have to look out for it. If there is any funny discharge that you see, you don't understand, please go to the clinic.
Yeah.
Because these infections start with the lower part. They start with the lower part, but then they keep ascending.
Oh.
And then it becomes difficult. So now they may start with the lower parts of the vagina, then they ascend to the cervix, and then they ascend to the uterus, and then they ascend to the tubes. Before you know it, you even have blocked tubes. You cannot even conceive, and they can also affect the ovaries.
So when you have blocked tubes, can you menstruate?
Yeah, you can menstruate.
Oh.
Just like if you do a BTL, you can menstruate. Because it's the hormones that are controlling this, but you may not be able to conceive. Because fertilization happens within the fallopian tubes, and that is where the egg comes, passes through. So anyways, to take us back to our STIs, so a woman has to watch out, has to make sure to take note of the smell. That's important. Any funny discharge that is coming out, any funny growth, even as small as it is, please rush, because it could be herpes. That could be what. So you come to the clinic, you get tested, and then you get treatment. Some are curable, some are not curable, but at least even if it's not curable, the symptoms go away.
Yeah.
Because sometimes if it's asymptomatic, you may not easily spread it. But then if they're seeking for this medical treatment or medical help, they should as well involve the partners. Because why would you treat yourself alone and then you have to go back to your partner?
Yeah, who is sick?
They're also infected. So you need to seek treatment, both of you as a couple. And then after the treatment, at least you can engage knowing you're fine.
What happens when a man has more sexual partners, where you find that a man has 4 wives and he's the one moving within the 4 wives, or he has other girls outside his marital home? What happens? Do we bring the women also with us?
Yes, I've seen a Haji who had 4. He brought 4 of them. Yes, by the way, men should know, when you're considering having so many women, you should have money.
You should have money, men, if you're
Because
considering having many women.
because I mean, now, like, when one is infected, the sexual circle is through all of them. So like, you need to treat
all of them, all
all
4.
of them, all 4.
Haj. All 4 of the women. If one
Let's
is
say
infected, all of them.
maybe this man is a Christian and has the side chick and then has the wife.
Mistresses. They've moved to mistresses.
So that person also has to treat the other one and also treat the wife. And
Both
also,
parties.
they should do an HIV check. HIV nowadays is spreading so fast.
HIV, we go back to the HIV. Is it still a threat?
It is. It is.
So young girls out there, do not just have sex with somebody before you test them.
And for the young girls, thank you for mentioning that. For the young girls, it's really serious. The young girls do not know what is happening. They're more scared of getting pregnant. So they will do everything not to get pregnant. And then they forget about the STIs and HIV. And in the end of the day, yes, they've not gotten pregnant, but they have HIV. And then they're sleeping with their peers. And then they spread it to the boys. And then the boys spread it to the girls. And the
whole sexual network.
Exactly.
So if before you, ladies out there, before you engage with somebody, please know that you know their status, and not just their HIV status, but also the other STI status. People are not well. And these days we have women and we are doing oral sex. And somebody can one get, HIV through, giving a blowjob?
It depends. Now, you might not get, but if you have, there are some people who have ulcers in the mouth, like they have wounds,
In the
and
mouth.
then these wounds can get the HIV. So like the transmission can happen through the wounds.
But one can get warts and herpes.
Exactly.
So as you give blowjobs, my friend, there are herpes and warts waiting for you.
Even HIV
Please.
itself.
Even HIV. So please make sure that you know the status of your partner, and you know who they sleep with, and the status of the person they sleep with if you are more than one sexual partner. And get tested. So we talk family planning. Before you go for family planning, you understand the STIs, and then you can go for your family planning methods, and then you check your fertility levels. And any parting shots for a young woman or a woman out there that is, seeking to improve their reproductive health?
Now, a woman who is seeking to improve their reproductive health, there's so many things. Like I said, vaginal hygiene is a priority.
Yeah.
You can even miss a meal, but don't miss bathing down there.
Please wash your cookie.
Make sure it is clean. Because I mean, there are some people who will wake up in the morning, shower in the morning, go get tired. They've been in panties the whole day. They come back, and since they're very tired, just lay on the bed and sleep and wait for the next day.
Do we have to wax?
You're doing this part an injustice.
Don't do the female part an injustice. Do you have to wax or trim, or can women grow their pubic hair for a very long time? You can even play it and put uswas.
No. Because the pubic hair also is something that is going to make a woman prone to getting infections.
Yeah.
So let's keep it as short as we can, because
Trim the pubic hair.
It makes you vulnerable to getting infections. Anyways, a woman should make their body a priority, their whole body.
Because we've seen women who even plait, they plait their pubic hair very well and decorate it. That is wrong.
Depends on their culture. Maybe in their culture, also when we are looking at these things, there is also culture on the other side. But okay, your culture is maybe promote you, or your partner is interested in long pubic hair also. Yeah. But how clean is it?
Yeah.
How clean is it? Because it's going to be sweaty down there, smelly, the urine. How clean are you going to keep it? Because you're urinating, this urine is touching here.
Yeah.
And also there are some microorganisms in the urine, and then they go to the vagina, and then you're getting infections. So people should
clean themselves up
so well. Me, I tell women, if you can get access to water, make sure anytime you get access to water, like you go visit the toilet, clean your cookie, make it clean. And it's not about washing it with water, also patch it dry, because then there are those ones who wash and then they don't patch it dry, and then they have water, and then it's on the panty, and then it's
a whole mess out there.
Exactly. So then they will tell you, but I washed with water. Did you dry it?
Dry it off.
Yeah, wash with water, dry it off. Make it clean and dry.
Be as clean as possible.
Exactly. Hygiene is very important
for women.
Yeah, then you can start thinking of things of, like we said, your body is a priority. Then do I want to have children? If I don't want to have children, let me have my family planning. Let me be ready all around. Yeah. You prevent unwanted pregnancies. You prevent STIs. You prevent abortions. Of course, when you prevent unwanted pregnancies, you even prevent abortions. You prevent the STIs. And you're good to go.
Thank you so much. It has been a good discussion, and for women out there, please take care of your sexual reproductive health. go to your nearest clinic. You're feeling a little bit funny, see a gynecologist or a clinician. Make sure that you are having sex with a person that you have checked with. Please take care of your health. I have been Chetunga Rebecca Juna, and thank you, Miss Shamila, for joining us today. Until next time, bye.